In today's episode, we'll discuss how to improve faculty engagement and feedback. Let's talk about holistic success. Hi, everyone. I'm Kelly Dore, co-founder and VP of Science and Innovation at Acuity Insights. Welcome to this episode of the Holistic Success Show. Here with me today is Sylvia Mioduszewska, our Senior Product Enablement Specialist. Sylvia works closely with our partners to develop 145 further and knows the ins and outs of program management in medical education and adjacent health profession programs. She's here to talk about engaging your clinical faculty in supporting program and learner success. Welcome, Sylvia. I am really excited to talk about this today. As a faculty member, I'm interested to hear what you had to say, because I think I got to see both sides of it, both in terms of nudging our clinical faculty to do certain things or engage, but also with understanding the pressures of a busy faculty member. And I know you have seen both sides. I'm excited to hear what you have to say.
I'm excited to be here, Kelly. Thanks so much for having me. I too have been on the other side of things, where I was an administrator trying to get our clinical faculty to do all the things that we ask of them above and beyond all of their clinical duties. And so I think we'll have a really great conversation, and I suspect we'll need to have many, many more. So looking forward to chatting today.
I am looking forward to it. I mean, if we can solve it all today, I know programs will be excited, but I feel like this is a complicated issue. We put a lot of requests on our faculty in terms of their time, the way that we resource them or the way that we compensate them can vary a little bit, but this is a complex topic to unwind. So let's get started. So Sylvia, let's start. We know medical, dental schools, and other clinical programs have access to amazing clinicians to teach their students and trainees. But with clinical faculty, there comes some unique challenges. Let's start by laying out what are some of the biggest challenges you've heard about when you're speaking to programs.
Oh my gosh, I think dealing with faculty comes up as one of the things we hear about most frequently. Going back to even a user conference we hosted in 2019, our entire panel was derailed talking about how do we help our faculty, how do we get our faculty to help us. This is such a huge topic, and you're right, there's so many problems that are multifaceted and all over the place, and there is no one solution, although I wish there was. So we hear about a lot of systemic challenges, and we actually heard this recently in a talk I did talking about resistance to change, which is a natural human thing. We all resist change. But when you layer that into busy clinical practice and all your competing priorities, that becomes a bigger issue for our clinical faculty, especially. We hear about the challenges in adapting to new teaching modalities. So things that came out of the last 4 or 5 years, really kind of change things around for how we teach. And that's a new thing that our faculty had to learn. They've got large numbers of learners. And because of those large numbers of learners, they have to document those encounters and that feedback. And so we're seeing, increasing evaluator burnout. And so those are the kind of things we're hearing about a lot. And what we hear from programs often is we have problems with faculty compliance, but that really is just, that's a symptom of the disease. And so we really have to kind of look at that underlying cause and try to address that versus, how do we get our, faculty to fill in those forms?
Absolutely. Those forms, all those forms that we have, that we want to do in a timely way, that we want to make sure are robust enough to make sure folks are getting feedback, but it can be overwhelming.
The second thing we hear a lot about as well, because of our faculty are actually clinicians, is around faculty understanding. So it's that lack of background in education that we can sometimes see. Those are the folks who are really our clinician teachers. Sometimes they're adjunct faculty. Their primary role is not teaching or developing curricula. So we have challenges there because we have a large number of faculty, but they may not all know exactly what we're trying to do and how we're doing it. And the second piece is because we have so many wide faculty who are affiliated in such different ways, that there's challenges in getting them to provide constructive, actionable feedback for learners. And so I think that's another thing we hear a lot about as well.
Absolutely. As campuses are adding distributed campuses or merging with other campuses, faculty who may not have expected to be assessors or have trainees in their practice are now taking on that role. And you're right, we have expectations that because you're a clinical expert and highly competent in that way, that you can also be an educator. And that's something we've talked about for a very long time. Not something we've changed, but a problem that's existed in the realm for a really long time. So,
Absolutely.
given the complex nature of this, are there any short-term small wins schools can think about to help address the challenges with clinical faculty? Or is there anything that they can do or take action on?
So the thing that I focus most on are things that actually are really within the school's realm of control and within the program's hopefully realm of control. And that's, those are the things that don't involve technology directly. And that is really considering the length and frequency of your assessments. And this is true for both learners and faculty. This is really happening in both directions. You can't easily stop all of your clerks or your residents from flocking to the same, faculty member for assessments because either they will fill them in, or they're just really good at giving feedback, or they just happen to give, slightly higher scores. But you can make it easier on the faculty member when they're actually filling in that assessment. So in terms of summative assessments, I would really advise that keeping your forms as short as possible while still thinking about the validity of that assessment tool. There was a great study that came out of the University of Toronto a few years back, and we're hearing about this at a conference I went to, where they cut their in-training evaluation reports or ITERs from 27 questions to 14, I think was actually the split. And so there was a small decrease in the overall validity of the tool. It actually was still more than adequate. Like, they didn't really see enough to make it not usable. So imagine, as a faculty member, Kelly, the difference in completing a form that's nearly half the length that you started with.
And imagine the number of forms that they would have had completed over the old forms.
Yeah,
So you're actually getting maybe even more data, even though you're shortening the questions.
absolutely. And if you're able to shorten that and provide other ways to deal with it, then maybe you can also get better qualitative feedback as well if they're not checking off 27 radio buttons on your Likert. So I think that's a really key piece for those summative assessments. They tend to be long, and with good reason, but maybe we can make them shorter. And I think we talked about frontline faculty, may not have yet had the opportunity to attend continuing professional development sessions on how to give coaching and feedback. So you want to make sure that those, especially the summative assessments, have really clear rubrics to make sure that their faculty know what the expectations are. You want to make sure your Likerts have appropriate anchors that are descriptive, and that should allow them to give better feedback. So you can teach them how to use the tool that you're using to improve their own feedback. And there's a great use case in this coming out of Canadian GME and using entrustable professional activities, which I'll talk about in a second. In those forms, and I'll use the term that we use in Canada, those are called milestones, and they're really essentially the subtasks of a given EPA. And what I love about them, and what I see especially in EPAs coming out of UME in Canada and the US, is they're really too short. And so there's a sweet spot. It's a Goldilocks problem. If you want to have those subtasks, if you want to talk about those key components, faculty can then use that to say, okay, you didn't do this thing here, and what you could do next time is X. Right? Give them kind of those building blocks. There's different ways you can kind of give them that kind of nudge on the assessment tool itself. It doesn't always have to be what's in their minds, which are already full of information.
And I love that a lot, Sylvia, as we think about, some of our faculty spanning a wide range of learners that they have to assess and evaluate in the moment. And they can't always go back and check, where are they supposed to be in terms of their ability to execute, or what things am I supposed to be focusing on in this rotation for this learner or this rotation for this learner? So you're right.
Yeah.
There's ways that we as programs can actually facilitate making that really easy for them.
That's true. And actually, in an OSCE I ran a while back, I actually came across this idea too, that our faculty would be assessing, PGY1s to PGY3s. And they kept saying, I don't know what a PGY1 should be able to do versus a PGY3. And so what we adjusted how we actually scored the entire OSCE and gave them the tools to say, okay, what we expect, we don't care what we expect. What they can do is this. right? There is an expectation. It really is just about what they can actually do. And so again, OSCEs and WBAs are a little bit different than a comprehensive summative assessment, but I think we can kind of learn from those things together. For more formative assessments like WBAs, I think we can use technology to really benefit faculty. The one key thing that I always talk about is that mobile technology has built-in dictation. And so imagine you're able to do a couple things. One, you can dictate your comments. I know for a lot of us, we can more easily speak naturally than we are as we're sitting down and trying to agonize over every single word. So maybe you can just almost repeat the conversation you have with the learner, or even just record that piece in that field and then go back and edit it and clean it up a little bit. I think being able to use that can be really powerful rather than trying to have someone type those things out. And sometimes it feels artificial.
Absolutely. And more time consuming too. They're missing clinical time, which is the most critical for them.
And like one thing I should mention as well is in terms of frequency, I know it can be really tricky to reduce frequency of summative assessment. You can't really do that. So that's where form length really comes in. But one thing to consider too is thinking about, if you've layered in things like EPAs, like you want to really analyze those faculty contributions, understand who's being asked and who isn't and why. And we'll talk a little bit more about why I think later on, because I think we need to do a little more understanding what the barriers are to address the ones that are unique to our institution, because they are going to vary from school to school.
Absolutely. I'm excited to dig into that because there's a whole thing about, some faculty filling out certain types of forms or focusing on certain EPAs over others and how you create that. I cannot wait to dig into this. So short term, we have a few solutions that maybe programs can take on board with the way they're approaching, whether it be summative assessments or formative assessments. What about longer term solutions? How do we start thinking about this very complex problem over the course of a long term?
One, in my mind, I'm actually creating almost like a mind map of all of the problems that lead to our faculty issues, because they are honestly numerous. So I think one of the biggest ones I hear about, and I hear this across schools, across geographies, and it's again, we talk about the Goldilocks problem. This is a paper cut problem. It's like a small problem that's causing really big pain points. And that's logging into whatever system you're using. And so, how do this? I think we need to think about how we actually enable our faculty and our learners to access these systems. And so I suggest schools should work with their IT folks, because this is really about what is allowable in your institution and across your hospital systems. This is very complex, but also, it's why it takes a little more time and effort. But, consider maybe training your faculty on how to use the password managers on their computers and their mobile devices. I think most of them usually have one, whether you're an Android or an iPhone user. There's a password management ability, especially as more and more schools are moving to multi-factor authentication. We're going to start seeing decreases in faculty, logging in, because they're going to have to try to log into the system and then do the MFA code and do all these extra steps. And while that's really important, security is paramount, especially when dealing with learner, performance data. We also have to figure out how to make it easier for faculty to actually get in there. Otherwise, we're going to see more problems there. Another alternative, which again, this is a bit spendy, and I know budgets are a thing, but we could also buy password managers for your faculty, which could also enable you to share passwords for certain tools as needed across programs. And so I think we ought to consider that as something to look at, because that can be a huge barrier. And we've actually heard from programs say our faculty can't even get into the system. We just print them a form.
Wow,
And
which is counter to the whole goal of it all.
Yeah. And then someone's got to enter that form into a system of record, because you still have to have that data when you're having your committee meetings to review progress. And so we really want to think about how hard is it for those people to get into the systems they need to actually access.
And we had this at McMaster too. We would sit around, our post-grad meetings looking at assessments, and we would find certain departments or divisions had, just low uptake of form completion, and it was a password issue. Whether it was a multi-site issue where they had different passwords at different sites, or they had, just really the problem of just logging in the first place. And so how do we address that? And thinking about that as a bigger solution that can be tackled.
I think the trick is though, password managers are both a security thing that IT teams need to really consider. But I want to also add there's a bigger solution that is a lot more challenging. And so I want to talk about the idea of a federated identity. And for those who have a hospital system connected to a university. So I first heard of this concept in 16, 17, when my own school was looking at a federated identity with our hospital system. And in 2024, we still don't have one. So it basically allows users to use their identities interchangeably so they can use their university credentials to log into hospital systems and vice versa. So we often hear about is faculty wanting to use their hospital credentials. They don't really want to use their university credentials. And plus, they don't want to use two credentials. Like it's already overwhelming. And so, that's a huge undertaking. But if it's a possibility, I mean, if you start talking now, by like 2030, you might have a solution. And who knows, maybe then AI will have solved all our problems anyway, but it's just a consideration that, we really want to reduce those burdens that folks have in order to actually access those systems.
And I think that makes so much sense, because if we can create a unified process for faculty where, because it's not just these assessment systems, it's all of the systems that they have to log into. We know with electronic medical records and everything else, there's lots of logins, lots of things that are happening. And so thinking about how do we ease the burden to just create, again, more ease of access, more consistency, so that they know, whether that's a way to manage their passwords or creating sort of combined access where it's available. I think that takes some of the pressure off the burden that we're adding to them in terms of all these assessments.
I think one thing I want to mention too that we haven't talked about, which should be its entire own conversation, is really about faculty development. And so again, when we think about, medical schools are kind of unique in terms of the sheer number of faculty they have. Dental schools follow or close second. Other health professions programs are not dissimilar. You have people who are distributed. You talk to different sites, different campuses. If you're talking with different cities, sometimes entirely. And so again, if you think about it, the further your faculty are from your actual physical location, the less kind of control you have in terms of what they're doing. And the harder it is for them to kind of come in and do that faculty development. So I think, again, whereas the last few years and all the changes that happened affected how faculty deliver teaching, they can also then be that teaching and then be flipped around, delivered them the same way. And so, think about meeting your faculty where they're at, deliver, that faculty development in small actionable bites, perfectly online. We offered 3-hour workshops at my institution, and that was great. But imagine what it takes to get an emergency medicine physician out of the ER or on their limited free time to come in for a 3-hour session on coaching and mentorship. It's important, but is it more important than the other million things on their plate? So think about, can we actually give them small workshops? Can we make something that's more like LinkedIn Learning, where you actually have short 10-minute bites of things versus a 3-hour workshop? You do lose that interactivity. I think that's really important, but I think it's better to get them some information in small bites than it is to try to get them in for a 3-hour session.
Absolutely. And it's always a balance,
Yeah.
it's can you do some delivered some way, some at an education retreat another way, but again, I love your way of thinking about meeting them where they are so that you can actually scaffold this learning for all of them, across every year that they're doing. There's a little bit, there's refreshers, there's pieces that they can take with them. And then it counts towards their ongoing professional development where possible.
Exactly.
Okay, we've talked short term, we've talked long term. As we both said, there's a lot more to unpack here. But given what we've discussed today, what are your top 3 takeaways for improving faculty engagement and feedback?
If I could say it 3 times, I would. The biggest impact you can have is non-technical. And so really consider the length and content of your evaluation forms. Again, that goes in both directions for your learners and faculty. They have so much on their plates. Figure out how to condense that as much as you can. But if I had to actually adhere to the spirit of the question, I would probably think about faculty development and really kind of giving that development, as you said, scaffold it in easy bite-sized ways. Make sure they can leverage technology and how they can give better feedback and really focus on those 2 things. Those are kind of the biggest barriers. And finally, speaking of barriers, like you have to actually know what those barriers are. You talked about things at your institution. Like I heard about things like there was a dead zone in the radiology clinic, so faculty there couldn't give feedback. Right? They had to wait till they were back in their offices. So if you do that analysis, if you go in, look at those formal completion rates, even at that surface level, it might tell you where there's things that you could actually help in some way. And if not, at least you can figure out who the faculty are, maybe who need to have different conversations with division or department chairs. There's also, of course, there's always going to be a small cohort that maybe needs a little bit more personal attention in that way. Just like our learners, right? Identify who's struggling and find them a way to help. So I think those are the three things that I would really focus on.
I love that. We had the same dead zone issue at our institution. So I know they exist out there. And it was one of those barriers. So finding out again for each group, what are some of the barriers that they're facing? I love that. And as you say, pay attention to your forms and where your faculty are at. Sylvia, thank you so much for sharing all of these insights today. We look forward to discussing this topic a lot further because, there's so much more that we can unpack around our clinical faculty, how to support them, and how to really set our programs and our learners and our faculty up for success. I know this is a topic that you're very passionate about, so I can't wait to chat more. To all of you, thank you for watching and listening. If you haven't subscribed to our show already, please do so and share the episode with any colleague who you might find it useful. And with that, we'll catch you in the next episode.
If you enjoyed this episode of the Holistic Success Show, please be sure to check out our other episodes. We have episodes coming out regularly all the time, so please be sure to subscribe so that you can stay up to date on all things related to student and program success in higher education.